Greetings to all of our viewers out there watching community television, and welcome to another edition of Sidelines and Beyond. I'm Dave Clifton. I'm here with co-host Ron Sanders, a good friend, and Ron, it's been a while since we've chatted in between shows.
Yes.
And a lot of things have happened. The New England Patriots, of course, won the Super Bowl.
Roger that.
And back in the town of Sharon, they have a new public safety building for both fire and police.
Yes.
New superintendent of schools. And here in the town of Easton, they too have a new superintendent of schools. They have a new town clerk, and they're talking about a new town administrator. So a lot of things are happening in communities here in this definite area. We have an in-studio guest. And today we're going to be talking about a very timely and very serious topic of discussion. And it's called an epidemic of opioid overdose. It's kind of scary. And you see what's going on, and I've seen some stats. And last year alone, we had close to 2,000 people who have overdosed.
I know. I picked up the paper that day after the Department of Public Health reported those statistics, and I mean that headline, opioid toll near 2,000 in 2016, just jolts you. It's staggering, and because I knew about this program, I did a little arithmetic and found that since the year 2000, the increase in opioid-related deaths, either confirmed or estimated, the increase is 557%.
And the questions that I have is, why are young people overdosing? And of course, sometime during the show, we're going to show a quick video that talks about Narcan, and maybe now's the time to show that. We have Lieutenant Pat Glenn from the Quincy Police Department. He was recognized at the White House, Ron, for his creativity along with his department for coming up with a different kind of way to react as a police department. They feel very strongly that they want to make sure that the young people know that if someone makes a call, if their friend overdoses, that they're not going to be arrested, that we're going to send a rescue team there to do what we can to help out. And this Narcan, it's a drug that changes the life of someone who's in cardiac arrest, and it's truly amazing. Let's take a look at this quick video featuring Pat Glenn, a lieutenant from the Quincy Police Department.
Philosophy before was basically to arrest everyone. Basically, as a bean counter, arrest, arrest, arrest. And as time went on, we realized we had to change our philosophy. The fact that we cannot arrest ourselves out of this epidemic of substance abuse, specifically opioid overdoses and the deaths related to that, we changed our philosophy to the fact of attempting to get people into treatment. Some of the pitfalls we had with the 911 call and people fearing calling 911 in order to assist someone in an overdose state was the fact that they felt they were going to be arrested. What ended up happening, the legislators changed or tweaked the Good Samaritan law that we now have, which incorporates a portion that states that individuals who call for assistance, whether for themselves, family member, or a friend, will not be arrested for simple possessionary charges of a substance. But the scope of the problem here was really brought to light when the mayor was running for office. There was a new mayor coming in, and his platform was fighting substance abuse. And what can we do for that abuser to make them a better, productive member of society? And it hit upon him in one door that he knocked on, and the family opened the door and they stated, well, what we need is nasal Narcan. And the mayor said, what is that? And from there, we were able to make that blossom into the program that we have now. And the mayor started a drug awareness task force with clergy, the courts, probation, law enforcement, family members, and outreach programs to see what we could do.
Started carrying the Narcan back in 2010, and we started using it right away. We got a call for an overdose at a residence in Quincy Point. A woman's boyfriend came back with her sister from going to the store, found her unresponsive on the floor. My partner and I put the Narcan together, gave her a quick blast in each nostril. A minute or two later, she started coming around. We saw some eye movement, then she opened her eyes, and then she woke up, and she told us that she was just taking a nap.
We did have some issues in the beginning, but it was more so of misinformation. People were misinformed that they thought we were going to be delivering it with a needle-based delivery system as opposed to a nasal spray. And once everyone was educated on that situation, a lot of the apprehension was removed. But still, there were a lot of individuals and some officers that did not believe that that was our primary function, was to administer the drug. And here in Quincy, we're a little bit unique where we have, it is in the police cruiser, it's on our bicycles, the community police officers, it's on our marine units. We have a number of boats that are out in the harbor. So we have it widespread. Basically, I like to say, within an arm's reach of a Quincy police officer, nasal Narcan is available. And through the three-tier system of the police officer showing up, the fire department, and the ambulance, we get to the best service we can for that citizen and off to the hospital as quickly as possible. In the first 18 months of the program, we reduced the deaths by 66%. We've had 260 overdoses that the police department has responded to since October of 2010, when we went live with the Narcan out in the cruises. Out of those 260, Narcan was deployed 174 times. And out of the 174, 168 were reversed. So phenomenal numbers for the men and women of the police department. And the reason why it wasn't 174 reversed, there were a number of individuals that were already deceased. Someone just didn't feel comfortable calling first. And that we feel bad about. If we were able to get there sooner, we could have reversed that, hopefully, and off to the hospital the individual could have gone. And then in the other ones, the one or two others, they were not an opioid. The Narcan only works on an opioid.
It's a good tool to have. It's another tool in your toolbox. Because, it could be a couple minutes before the ambulance gets there, and then if it's in an apartment building, getting up to the apartment. And so for us to easily just take it out of the glove box, put it in our pocket, go up there, and we're usually the first people on scene, it's an interesting tool, I think, and it's good for fast deployment, too.
Once they're familiar with it, they've used it a number of times, they see the reversals, they get to see something concrete to their actions.
I just hope that it's widely accepted in the areas where there is a lot of heroin use and Class A use. We
received word from a treatment facility. There were two individuals that were in treatment, unknown to each other, praising the Quincy Police Department because they stated to their counselor that they would not be alive today unless it was for the officer that responded and reversed their overdose and got them to the hospital. Some of the benefits of the Narcan program is the reduction of collateral crime, as I call it, which are purse snatchings, breaking into cars, breaking into homes, robberies, all in order to get cash so they can go out and buy the substances. So if we can get some people into treatment, that'll reduce that. Recently, there have been a number of inquiries from around the country of calls wanting to know particulars about the nasal Narcan program here in Quincy. As a matter of fact, as recent as today, I received a call from Florence, Kentucky, and they were looking at trying to start a program there also. California is called Colorado, New Hampshire, Maine. The calls are just coming in from all over the place that they're interested in this. They want to start a program. They Google nasal Narcan and the city of Quincy pops up. Nationwide, we were lucky enough to be recognized by ONDCP, the Office of National Drug Control Policy, and Director Kolarski. We grabbed their attention. A local police department was able to partner with the Department of Public Health and other human services to come together and recognize that there is a problem and to change our philosophy. As I stated, we cannot arrest ourselves out of this epidemic. And they recognized that, and it became one of the chapters of the President's strategy on the war on drugs in America. 3 to 5 years from now, probably see every police officer trained throughout the country with nasal Narcan in order to do the job of helping people. Another tool in the box.
And welcome back. You're watching Sidelines and Beyond. Ron Sanders and myself, we have done Sideline Show, which is strictly sports. But we also do Sidelines and Beyond, which opens it up to many other important things happening in a local community. Our guest here in the studio today is the smiling Jennifer Knight. And Jennifer, of course, has a major role over there in the town of Franklin. She happens to be the vice president and the founder of Safe Coalition, Inc., which is an organization that is doing some good things when it comes to drug abuse. So I'm going to ask you, Jenna, if you don't mind, maybe you can give us an idea of the mission of Safe I should say Safe Coalition. I almost said Safe Passage. But
one and the same.
yeah, we want to make sure that people out there that are watching this cable cast can pick up some tips, because we're very concerned about what's going on. Jennifer, thank you for joining us here, and tell us something about your mission.
Well, thank you for having me here. It was such a wonderful opportunity, and this kind of concern about opioid use and opioid addiction is just in all of our communities, so it's wonderful to be here with both of you. The Safe Coalition is an organization out of Franklin that's a nonprofit that provides supports to those living with addiction and those surrounded by addiction. So we work with addicts as well as their family, their friends, their schools, their teachers, their coaches, to both have an understanding about how addiction works and to support someone through their journey of recovery.
Now, Dave, you well know that Jennifer is the epitome of Sidelines and Beyond, because she was inside the sidelines as a hockey standout in Franklin, and you still get on the ice now and then?
Absolutely. I played in my alumni game a few weeks ago, and hopefully I can get back on the ice after I'm done planning a wedding. So hopefully this summer I'll be able to get back on, which will be great.
That's
Congratulations.
terrific.
Thank you,
We
thank
certainly
you.
wish you the best with your new life as
Thank
you
you so
prepare to get
much.
married.
Tell us a little bit, Jennifer, if you will, about how you went beyond the sidelines, and it involves, as I understand it, some friends.
Absolutely. So I had lived in California for 6 years, and I moved back to Franklin because I wanted to be closer to my family and my friends. And upon moving back here, I was running into folks who I grew up with, whether it be at the grocery store or the gas station or the convenience store down the street. And so many of them were coming to me sharing their life over the past 6 years, and some of those were beautiful moments, and more often than not I was hearing so many stories of hardship related to opioid addiction, whether that be that people have been living with addiction for years, or that some of the people that I graduated with had actually passed away while I was gone. And that really jolted me. I really expected to come home and share these beautiful stories of the past 6 years with people, and that wasn't what I was always getting. And so I work in the field of mental health, which I absolutely love, and so I really thought deeply about how people were sharing their concerns and how there wasn't really a container for them to get the kind of support that are in other areas of the country. And so that really urged me to reach out to our state rep, Jeff Roy, to talk with him about the opportunity of creating a small support group for folks who may want additional support or may want to learn that they aren't alone or living in the margins of our community.
Ron, I know that you've been involved with the media for a number of years on some of the major TV stations. Have you covered a lot of drug abuse scenarios?
Yes, but it seems to change from era to era, Dave. And I was thinking about that just as we were preparing to tape this program. There was an era where so-called recreational drugs were popular across the spectrum of society, and there was a lot of cocaine abuse, which resulted in a number of deaths. contemporaneous with that was a lot of heroin abuse and violent crime associated with those things. Then there was meth, and now opioid abuse, which involves not only fentanyl, which we should talk about a little bit, but heroin as well, and prescribed painkillers. And it's now also, if I'm not mistaken, Jennifer, and you know more about this than I do, something that just doesn't have any geographic or even economic boundaries.
Absolutely. I think one thing that we've noticed over the past 10 years is that the majority of folks who become addicted to heroin first start off with prescribed pain medication. What we have seen more recently is that those who become addicted to heroin in their late 20s, 30s, 40s originally started off with a pain medication prescribed from a doctor in high school due to a sports injury. And so while we are managing and we're learning to have a better understanding of heroin, we really need to focus and look at what's going on during those really critical high school years and how we're supporting youth who have a sports injury or have their wisdom teeth pulled, which is where a lot of this addiction is actually stemming from.
You know, that was
From a dentist, right?
Yes, exactly. Dave and I were talking about that just before the broadcast, and in a couple of days after that blockbuster headline about opioid abuse in Massachusetts, which exists certainly across the country, was this story about dentists prescribing opioids. And forgive me for reading the paper just a little bit, but they prescribe about 8% of the opioids in this country, according to government researchers, but are the top prescribers of these drugs for 31% of all opioids, 31% to patients ages 10 to 19, and that's who you're talking about, Jennifer.
Yeah, absolutely. And it is hard for us to kind of sit on the sidelines and not do anything because we know that there are so many folks out there who are living with addiction. And so the way that we see it, especially in the communities that we work in right now, is that parents worked really hard to have really great jobs, to have really great health insurance. And that really great health insurance allows them to see a vast majority of different doctors and get their children the best care possible, whether that means that they have a first, second, and third opinion due to a broken arm or a first, second, or third opinion due to wisdom teeth being taken out. And so parents, of course, years ago, really wanted the best for their children. I know my parents absolutely did. And so they would go to the ends of the earth to find what that best thing is. And if a doctor who has a wonderful reputation says your child needs this medication, the parent is going to say, absolutely, thank you so much for meeting with us. We will go to the pharmacy and get that right now.
Well, in most cases, these drugs have been used in hospitals for people who are suffering in pain as a result of surgery. And the one I pick out is fentanyl, 50 times more powerful than heroin. That's amazing. And I did want to ask you, Jennifer, this affects the families as well as the person who is affected with this drug.
Yeah.
And you provide some sort of help and support for families as well?
We do. And kind of going off the comment about fentanyl, fentanyl is such an interesting drug because we are so used to talking about heroin. But what's really happening is fentanyl is being mixed with heroin, or people are just taking fentanyl on their own. And so what's happening is if someone is used to taking one drug and used to waiting 20 minutes for that drug to really hit its peak, with fentanyl, it almost hits automatically. And so the ability and time frame in which someone can administer Narcan is almost cut in half, which is really hard for us who are trying to have conversations with people about kind of timelines and waiting and how long a drug might take for someone to be reactive to. In regards to supporting families, one of the biggest things that we really want to work on is educating families on what addiction is.
Yes.
And how to support themselves and their loved one.
And what fentanyl is and what opioids are.
Absolutely, because I truly believe that education and parents want the best for their children, and friends want the best for their friends, and siblings want the best for their siblings and parents. And it is hard to work and understand addiction if we aren't really understanding and taking time to educate each other on what that looks like.
And if you folks out there don't think that it's close to home, let me read you another statistic. Opioid-related ambulance trips were reported in 280 of the 351 Massachusetts cities and towns. It's spreading like wildfire.
Well, it's been spreading for a number of years, Dave. Another statistic or a collection of statistics that really floored me, particularly when I compared it with other causes of accidental death in this country. And while we're talking about the magnitude of this problem, in the past decade, according to the Department of Public Health's latest figures in Massachusetts, if you add up all of the confirmed or estimated opioid-related deaths, 9,684 deaths have occurred in the past decade, and that's a 311% increase this year over 2006. In the past decade, 53 Americans have been killed by terrorism on U.S. soil. That gives you an idea about where our priorities are, because we have, and forgive me if I'm politicizing the problem, but it's a political problem as well. We have an administration now that hasn't said what they're going to do about opioid abuse.
I have a lot of comments about that.
Do you?
Yeah, I do. It is hard for us. We want to provide all of the best care to everyone that knocks on our door. And our coalition is all volunteer. And how fabulous would it be for us to be able to receive funding at a state or federal level to really develop these care plans for folks who come knocking on our door. And we do know the numbers don't lie. We see it every day, whether it be friends and family that we know, or whether we're watching the news or reading the newspaper. And so there does seem to be a misstep in the realities of what are happening in our neighborhoods and around the dinner table and in our households and in our school systems, and where the support is at a national level. And we could do so much more than we're already doing if we had support from kind of that national standpoint. Now, we do have fabulous leaders in our communities that have been working on this to the nth degree. Jeff Roy, absolutely. Sean Dooley has been doing this as well in his area. And so we have been working with politicians at the state level who really have been entrenched with us, supporting our cause as well as learning more so they can talk with their folks about what's really going on. One thing that I have seen is that we have had much more interest at the state level in Massachusetts around a better understanding of what is going on.
Well, that's particularly interesting, Jennifer, because Michael Botticelli, who was President Obama's substance abuse point man, is quite concerned about what repealing the Affordable Care Act will do to this ability or inability to handle opioid abuse.
Absolutely. And a few things from the Affordable Care Act that have come up that have been so supportive in actually saving lives. In Massachusetts, there was a bill passed that allowed for someone to be placed in protective custody from the police for substance use. So previously, you could be placed in protective custody because of your alcohol content. Now you can be placed in protective custody for substance use. So that allows an individual to be brought into the emergency room and kept there until the hospital believes that they are at a place where they would be able to leave and live a healthier life than they would before they came in.
As long as there's
That
space
makes
and
sense,
funding
yeah.
for those people.
As long as there's space and funding. And there are so many folks who, when they come out of that overdose, do not want to go to the hospital. The police say, we care about you and your life. We are bringing you to the hospital anyway. They get to the hospital, they talk with the counselor, and they are given the opportunity to go to detox, and they take it. That is because there is a bed available, because there's an ambulance available, because there is a counselor who is able to talk with them about what the opportunity of detox and the rest of their life might look like.
I can feel your energy as you talk about this, Jennifer, no doubt about it. I'd like to ask you, you're not just covering Franklin with your coalition. You have some other surrounding communities that are part of that coalition.
Absolutely.
Tell us who they are.
Most directly, we work with Medway. We have been working with Medway almost since the beginning. The towns are very close, and we have what we see a similar influx of folks who are either family or friends that kind of go in between both towns. But right now, we are working mainly with Franklin, Medway, Norfolk, Rentham, Plainville. We have beautiful community partners in all of these other towns, and we're hoping that as time goes on, we can really immerse ourselves with those community leaders and work really hands-on with developing support groups, developing Narcan training. That's something we are working with the Foxborough Police on right now. Last week in Franklin, we did a CPR and Narcan training. We thought we would have around 40 people, and we had 128 show up. And so
Wow.
we absolutely know the need is there. And so while we work directly with Medway and the towns that I listed, we also hold a Chiefs Roundtable every few months where we have chiefs from all different towns. And so far we've had 19 towns show up in that capacity. And that's really just to share successes and struggles and really brainstorm ways that all of us can work together on this issue.
And to be clear, not only to our audience in general, but to people who may be watching who have a substance abuse issue, the chiefs are not saying we're going to arrest our way out of this problem, correct?
They have been awesome. These chiefs come to these roundtable meetings and they say, hey, last week we had a situation. How would you handle it? Has this ever happened to you? I have yet to meet someone who says, we don't want to participate. We only want to arrest our way out of it. And that to me is beautiful, because that makes me believe that every single person that I talk to within the coalition and outside the coalition, I'm being honest and truthful and explaining that police do want to help you. They do want to participate in the next steps of your life. May that be that you go to the hospital and you participate in detox, or may that be that they Narcan you 2 or 3 more times. They are there to help you. And that has been one of the biggest differences.
If you just joined us, folks, you're watching Sidelines and Beyond. This is a production of ECAT, Eastern Community Access Television. I'm Dave Clifton, here along with Ron Sanders, co-host of today's show. Ken Wood is on camera, and Jason Daniels is producing today's cablecast. And what a terrific interview Jennifer Knight is.
You know, I was thinking the same thing, Dave. This is a fairly grim topic from one perspective, but to do something constructive about it in the way in which you, the SAFE Coalition, and your partners are engaging in is very uplifting. You also depend on donations, do you not?
We absolutely do, yes. And that's one of the things that we want to promote, that recovery is possible. I mean, how many times do we open the newspaper or we turn on the news after a long day of work and we see these really sad stories about what's going on in the world of addiction and opioid use? And that isn't the only story to tell. We know that there are overdoses happening. We know that there is addiction in our worlds. And what we need to celebrate and explore with folks who are living in that is that there's a beautiful world of recovery. And we also are all working together with a sense of compassion. The only way that we can hear each other and learn from each other is if we continue to stay open-minded and continue to meet each other with a sense of, we want to hear your story, we want to share ours. How do we do that together to have the best results?
You know, I was going to say that Jennifer is a much better interview than Bill Belichick, although I love Bill, and they did win the Super Bowl. But she not only has all the information, but she's able to put a smile on her face in terms of trying to do what she can to help people out. Jennifer, I know you had another question first.
You know, you just reminded me of something that was on my mind about sports and young people and the matrix of addiction and substance abuse. my father once said to me, sort of in a guiding way, although I was past the age where I really needed this type of advice, the best highs are natural. And if you look at people such as Tom Brady, not to mention the rest of the team, and if you look at people such as Bill Belichick, high achievers, you look at performance artists, despite the stereotype. You have Bruce Springsteen, who is by far one of the most popular, if not the most popular worldwide act now. Eric Clapton. These people are clean and sober. And that's an inspiration to young people that is sometimes lost, I think. You don't accomplish the kinds of things that most people would like to have for their lives if you're impaired.
Absolutely.
Another perfect example, I think, is Nate Solder. Ron, you
Right.
and I had an opportunity to interview him. He is spiritually sound. He's not only a great football player on a Super Bowl team, but he understands life. He understands society. He understands what the priorities are. And we enjoyed very much interviewing him. Jennifer, you have a manual. Maybe you
We
could
do.
share that with folks out there in the community.
Sure. So when we were having these Chiefs roundtables, one of the items that kept coming up in conversation over months was how do we support the families in the immediate moments of their child or their loved one leaving the home and being brought to the hospital. And we thought that maybe we could go and visit the families immediately, or that we could provide them with some kind of bag that had items in it for them to learn more about addiction. And so the more we talked and worked with different community leaders, we decided that we wanted to create a manual. And this is the,
Yes, let's put that right on
Safe
camera.
Coalition. What do we do now? Navigating the Substance Abuse System in Massachusetts, 2017. So this manual is a resource in the immediate times after someone has overdosed. So there's a table of contents.
And tell our folks what SAFE stands for.
Yeah, supporting addicts and family through empowerment. And so each one of these tabs, detox, aftercare, medication-assisted treatment, the signs of abuse, information about Narcan, the Good Samaritan Law, and family support services. All of these things are so crucial when your loved one is suffering from addiction. And so our hope is that when someone is overdosing, the first responders will hand this to the family or a loved one that is supporting this person, that they can look through this and they can both reach out to us and they can talk with their providers or learn more about the system and what the next steps might be. We hope that this is a first step for someone who just saw a loved one in a really hard state begin their recovery.
What could people do to get a copy of this? Who should they contact?
There's a few different ways. The Safe Coalition has a website, safecoalitionma.com, and on there is a link to our community email. Please shoot us an email if you would like a copy of that. That way we can get one printed and mail it out to you. There's also
Can you repeat that email again?
Absolutely. The website is safecoalitionma.com. That is probably the best way to be able to get one of these manuals. You can also contact our support hotline. That hotline really is for folks to ask us questions about what addiction is, how they can find community resources, and that line, it may take us a little bit longer to mail it out to you, so the best way is probably through the email.
What Jennifer, if it's possible, what are the most immediate signs that parents, brothers, sisters, others in the household might see to recognize a heretofore undetected substance abuse issue or opioid abuse issue?
Absolutely. So if you're living in the household with someone and you notice social changes, behavioral changes, changes in their grades. These are typically things that can signal that there's a shift going on, whether it be substance abuse or something else. Directed to substance use, what we have seen are the way that someone keeps their bedroom. So maybe there is more tinfoil in the bedroom. Maybe there are more water bottles in the bedroom. Maybe there are pens that don't have the ink cartridge in the bedroom. What we also notice is that there may be more silverware that's missing and possibly found in the bedroom, and definitely a change in social behavior. They're hanging out with different friends, they're hanging out with new friends, they aren't hanging out with their friends at all. Their grades are slipping. There are different comments from their parents or their teachers or their sports coaches that something seems to be disconnecting. There could also be a weight gain or a weight loss in the child. Also the way that they are moving through the household. So if your child typically would get up in the middle of the night to use the restroom and they're no longer doing that, that could be a
Temperament, personality changes.
telltale time. Absolutely.
And what we're talking about, not just high school students, we're talking middle school, junior high school age.
Absolutely. I think that if someone who is in middle school or high school is prescribed opioid medication, there are definitely signs to look out for. It won't happen right away, but it could happen in a 3 to 6 month time period. So just be aware, and I think that parents want to be aware, they just didn't know how before, or there wasn't a way to learn about this. And so the more that a parent can educate themselves, the more they can go to the doctor and say, I see that you prescribed my child this medication. Is there an opportunity for you to prescribe my child something else for pain that isn't an opioid medication?
Let's
And
talk
what kind
about,
of, sorry,
go ahead.
I was just going to ask,
Yeah.
and what sort of response do you think that most parents get?
Well, it's very interesting. It really depends on the provider.
Right.
Some providers really want to tackle this concern that's happening in the community because they don't want their clientele to live with any kind of addiction, and so they will say, absolutely, let me work on this with you. But typically, those providers would not have prescribed an opioid-related pain medication anyway. They would have prescribed Tylenol or Advil. What we are seeing, and I just came across this myself in a professional capacity, is that providers are not always listening to the concern of the parents or of the person seeking medication. So there has been a lot of legislation changes, and one of the things that is being pushed on doctors is for doctors and pharmacies to participate in the PMP, the Prescription Monitor Program. That allows a doctor and a pharmacy to place into a system when they are prescribing an opioid to someone. It also only allows an opioid to be prescribed so many times to someone in a certain amount of time. So for instance, if someone is being given a prescription for an opioid medication, they can only give that medication up to 7 days. Now, what we are seeing is that doctors are prescribing a 30-day cycle for someone to be on, even if they have a history of addiction.
So you have leftovers in the house.
Absolutely, and that's something that we are working with families on. Whether there is a history of addiction or not, we want to teach people how to get rid of medications within the household. Most police stations or fire stations do have a drug disposal bin where you can take them, no questions asked, and bring them. Some folks don't have a car, don't have accessibility, don't want to leave medications sitting in their household. So what I tell folks is there's 2 very easy ways to get rid of medications in your house. The first is to take used coffee grinds and hot water, put the medications and the coffee grinds in a plastic bag with the hot water, shake it up, throw it in the trash.
Is it, forgive me, but is that
No, it's-
environmentally safe?
It absolutely is. In fact, that's what we use. That's what the Department of Public Health in Massachusetts
Recommends.
The second opportunity to get rid of medications in your household is to take the medications, place them in a plastic bag, mix them with hot water and kitty litter. Again, seal that up, throw that in the trash.
Right.
So those are 2 things that if you don't have a license or you don't have a vehicle and you want to get rid of the medications, that you can do in-house.
And these may be life-saving measures.
Absolutely. There was a woman that came to one of our support groups. We had this conversation. She went home, took everything out of the house, one of her sons became incredibly angry and frustrated, and that's when she learned that he had been taking the medications and she was there for a different family member, not him. So you never know how these bits of information are going to influence an entire family dynamic, which is what we want to do, education, education, education.
Jennifer, let's talk about Narcan. I know earlier during the show we had a video from Lieutenant Patrick Glenn from the Quincy Police Department, and he talked about how it can overturn someone who's actually in cardiac arrest. Do you find out that there are lots of people that have been getting this when the rescue team arrives and have had a second shot at life?
Absolutely. What we have been seeing is that people who are participating in learning more about addiction are leaving our support groups or leaving our trainings with Narcan, and then they are using it. And before, a few weeks ago, the Narcan that was being given out was it was a glass atomizer. So we would teach folks how to put this instrument together and then how to spray it in someone's
Sprayed up
nostrils.
your nostrils.
One thing that was really hard with that is that it was glass, and so if you see someone overdosing and you are not impaired, you're shaking. And so putting these glass pieces together was really hard, and sometimes the glass was breaking before it was actually being able to be used on someone. And so what has just recently come out on the market and what we're giving folks is a plastic dose that is an actual higher dosage than what has been given. It's plastic, you pop the top off, and you can spray it in each nostril. The paramedics, EMTs, police officers use this all of the time.
And it's part of the training at the
Yep.
police academy. I know I'm teaching first responder and CPR for the Massachusetts Criminal Justice Committee. And Narcan is the topic of discussion. Police officers are now being trained in all the surrounding communities. They know how to use it, and it's expensive. You can get it at any pharmacy, and certainly it does save a life.
Absolutely, and the pharmacies, there is a standing order in Massachusetts, so every pharmacy can provide this medication to anyone. You'll go to the pharmacy, you'll ask for Narcan, they will train you on how to use it, and it's usually about $20. And in Rhode Island, there are all CVS's and all Walgreens are able to administer the Narcan as well.
You know, that brings me back to some of the policy questions, and I don't want to get bogged down in that, but
That's
do you feel, you mentioned that at the state level in Massachusetts, a lot is being done that perhaps isn't being done elsewhere in the country. Are you satisfied so far with what Governor Baker and the legislature have been able to do? I know that Governor Baker has increased addiction service funding by, about $60 million or so?
Well, you know, I think that there's always more to be done.
Yes.
And I think that what we are seeing, especially with the article that you read earlier, is that addiction is not going away,
right,
and overdoses are not going away, and so the funding cannot go away either.
Yes.
And so while there is funding to support services like community support groups and more Narcan, we need more of that, and we need that more consistently. And so, you know, Governor Baker, I know that he has been working on this topic, and at the same time, there were a significant amount of budget cuts, and that drastically influenced the ability that we have to do work in the community level. And so, while I would love to sit here and say that I am thrilled with everything that's going on in Massachusetts, I'm not. At the same time, we are leaps and bounds ahead of other communities in the country. Last year, we had the opportunity through the DA to be able to go down to the National Prescription and Heroin Summit in Atlanta, and President Obama then spoke. And it was an incredible few days, and when we left there, we had no idea the amount of people within the United States that are working and dealing with the same issues that we are. It's funny, we created the Chiefs Roundtable to bring people together and have deeper discussions, and we didn't even know that we needed that as well. And so from that conference, though, what we recognized is that every state is dealing with this, but they're dealing with it on very different levels. One thing Massachusetts has is it's a smaller state. We have a lot of doctors. We have a lot of excellent hospitals. most towns have fire departments and paramedics, and there are a lot of rural areas in the United States that don't have those kinds of supports and services. And so for Massachusetts, I think we are absolutely on the right course, but I also think it's just the beginning.
And we're still up 24% in terms of deaths as a result
Yeah.
of
24, 26,
opiate
yeah.
overdoses.
Yeah.
Jennifer, I'm curious to know, because of your immersion and your compassion, your immersion in this mission, and your compassion for the people who are victimized by it, if you think that there is a way to transcend this crisis level political climate in this country, where 66% of Americans are worried that we're going to become involved in a major war, or they're stressed about things in general, and we have an administration that seems to think the way to deal with opioid addiction is building a wall between Mexico and the United States. Is there a way to transcend that so that we can comprehensively handle the urgency of opioid addiction?
There has to be. There has to be a way to do this. I mean, we can put a man on the moon. We have to be able to work together to figure out both a way to support families at the most basic level of understanding what's going on, working with towns and communities to understand and support folks who may be living in the margins or who are living with addiction. We can work at the state level, absolutely, on working on current legislation and with our legislators on understanding addiction and how it works, and creating more beds for those who are living with addiction, creating more supports for families and friends in school districts who are inundated with this crisis. And there has to be a way at a national level for all of us to become more understanding as to what's going on. I think that our political climate right now is pushing a lot of people to become more tolerant of each other and learn more. And at the same time, I think that it's polarizing. And there are a lot of folks who believe that the concern of drugs in the United States is coming from Mexico. I worked on the border for 6 years, on the U.S.-Mexican border in California for 6 years, and I can absolutely tell you that the heroin in this country is not just coming, or the addiction concerns from this country is not coming from Mexico. You know, what I said earlier about Massachusetts, we do have providers and we do have hospitals, and while that is fantastic and people can get fabulous care, there's also a grave concern that because there are more doctors and because there are more hospitals, that people also have the opportunity to be given more prescription medications than in other areas.
She's a breath of fresh air.
Isn't it wonderful that rather than just
Wow.
resorting to despair,
But I still think
converted
that
your energy into action?
education is so important for people who have lack of knowledge. And I think the young people have to realize how lucky we are to have what we have and to live in a country like the good old USA. And we need to enjoy life. We need to make sure that young people who are going the route of drugs, that you should be able to enjoy family, you should be able to enjoy community, and to realize that it's important to stay alive. And I know that right now the pressure that comes up, it could be from schoolwork, it could be from the job, it could be from lack of funds. Where do you pay it? Which bill do you pay next?
Yeah.
Lots of things going on that's putting people in a different direction. And sometimes people have to have faith, whether they seek God in their own way, to be able to say to themselves, I'm not going to take this drug anymore. There's too many good things happening in our world. And I always remember somebody said to me once, as important as it is to enjoy the world, it's just as important to enjoy our life. And I think that's something that I always think of. But when I said you're a breath of fresh air, you do this with excitement. You make people who are listening be believers. And thank God you're there doing what you're doing. I think we're all in the helping people business, but You do a terrific job, and you're able to smile at the same time. I've been watching you to see if I could kind of pick it up more.
It is contagious, isn't it?
That makes me
Yes,
so happy.
yeah, you're right about that.
I mean,
Dave.
we're all in it together. I mean, we are either all going to succeed or we are all going to fail. Either way, we're all going to be together.
That's right.
And so we might as well be on the recovery end and learn from each other and share the beautiful moments that are happening and struggle together as well to get to those beautiful moments.
We can't just stay at home and because we're afraid to go out into society racked with opioid addiction where there
Right.
may be an addicted person driving a car at any hour of the day.
Yeah.
But perhaps we can do something within our own realm. If I read you correctly, that's what you're saying.
We have so much more to celebrate than winning a Super Bowl championship. I think we're lucky to be able to have good health and to be able to have good friends. And I think that should be a priority for all of us. As we get a little closer to the end of the show, Jennifer, I do want to ask you if you wanted to make some final comments in terms of you being here today, being able to spread the word, because we're all very concerned about the epidemic of opioid overdose.
Well, I just thank you so much for allowing me to kind of share what's been going on our end and the SAFE Coalition. And I think my final thoughts really are that we are all here together and we have to have faith that this is an opportunity for all of us to participate in saving each other. And if we all can just take the personal diligence to show up and be compassionate and learn a little bit more, then we have the ability to listen and change and support those whose light maybe have gone out. We all have the ability to share our light, and I want that to be something that folks listening kind of take in. And we at the Coalition, we want to work with you and we want to support you, and we want to hear what your struggles are, and we want to hear what your successes are.
Beautiful.
What would you like to say, Ron, before we sign off?
Keep hope alive and have a conversation.
We'd like to, Ron and I certainly would like to thank the folks that joined us here in the studio, including Ron's wife Jenny, who joined us today. A special thank you to our producer for today's cable cast, Jason Daniels, Ken Wood on camera, and this has been an interesting show, and I hope that you folks out there in the community can share this cable cast with others, because there was an important message here today. Jenny Knight, we certainly thank you so much for joining us here today.
Thank you so much.
You keep that smile on your face, and once again, I think we should let folks know how they can contact you with your email.
Oh, dear.
If they would like some advice,
Absolutely.
some counsel, and maybe a copy of that manual so they too can put together a coalition. They just put one together in the town of Sharon, and I'm very happy about that.
So we have the safecoalitionma.com, which is our website. On that website, we share all of the upcoming events as well as previous events. We have on that page a link to our Facebook page, which is the Safe Coalition as well, the link to our Twitter feed, Safe Coalition. We also have a way to email us, and that'll be linked. It's com@safecoalitionma.com. And we also have the support line for those who are calling with questions, whether they be around detox or family services or learning more about Narcan. And that number is 508-488-8105.
That's going to wrap it up for today's show called Sidelines and Beyond. I'm Dave Clifton on behalf of Ron Sanders, bidding you farewell from our studios here in Easton, Massachusetts. And I say to each and every one of you out there, do what you can to help others out. Yes, Narcan does help if there is an overdose, but what can we do as people helping young people out so that they don't get involved in this kind of a crisis? Drive safely, and thank you for joining us.